Okay, and if you'll give me just a minute to get my slideshow going. All right, now that I've got all my screens where they need to be, let's try sharing. All right, everybody able to see the first slide? Thumbs up. All right. So I thought I'd have a little bit of fun. We're going to kind of focus on casework today, and what does casework look like from the SMP position or from an SMP role. And I'm going to talk today more specifically or probably more directed toward what a volunteer role might look like or a sponsor role might look like, not as much from the role of, say, myself as a caseworker with SMP fraud cases, or some of our other staff like Philip or Samari or NG, or folks that are also here. So a lot of this will be geared towards those of you that are volunteers. So I thought I'd have a little fun and do a Toys R Us play on words here. So we've got Scams R Us today. They are not toying around. Spot the tricks and stop the fraud. So that's our goal today. And as I move along here, so I do want to thank you for being here. This is session 2 of a 3-part series. Our next session will be, I want to say it's May 16th. I don't have it in front of me. Correct me if I'm wrong. It could be May 14th. I think it's the 16th. And we are going to focus in May on how to take the interactions that we have with the public regarding fraud, errors, or abuse, or the SMP program, and enter it into the STARS database. What does that look like? What counts, and what's important for the program performance measures. SMP areas of focus are always going to be prevent, detect, and report. So you'll hear those 3 things constantly. You'll hear fraud, errors, and abuse constantly. So those 3 words on each side of the equation are going to be where our focus goes. Our goal, again, is to teach people through individual and group outreach. So goal 1, teach the public how to protect themselves and how to detect fraud when it happens. If it does happen, or when it does happen, to be able to counsel those who might be the victim or the subject of a scam or a fraud event. The other part of it that is important for us as a program and showing our impact to our, national funders is to tell the story. And we do that through media outreach. So we do that both through the Sheba program and the ways that we do podcasts or interviews or PSA campaigns, that sort of thing. But you all can also do that through Facebook posts. So your social media, if you do newsletters telling stories about how somebody encountered fraud and then how they reported it, things like that. So telling the story is a huge part of our outreach. And then reporting fraud, that's hopefully eventually how we stop it. A couple of housekeeping things. Most of you are probably pretty familiar with Zoom at this point. We've been doing this for a few years. But if you're not, either on the top or the bottom of your screen, you will find your navigation bar. And that's where you can mute and unmute, turn your camera on or off. There should also be a chat icon there, and you can use that like you did if you introduced yourself through the chat. You can also do that if you have a question or a comment, but you can also raise your hand. There is an icon for a raised hand. So if you raise your hand, then I know to stop and find out, what your thoughts are, or if you have a question in the moment. I do ask that people keep their microphone muted, just because we all tend to have background noise, whether it's our dogs, and mine will start barking before too long, or our spouses, or people working on our yard, or whatever it is, right? There's always background noise. So just keep your microphone muted unless you have a comment or a question. And again, you can raise your hand at any point in the presentation. I like this to be more conversational style, so I will be presenting a lot of information, but I also ask you to chime in with your experiences, questions. If something's not clear, or you want me to clarify about something that I'm saying, please do raise your hand and let me know, and we'll stop at that moment. So again, prevent, detect, and report are the key things that we're always looking to focus our efforts and our activities. Prevention is, the key message is protecting personal and health information. It used to be just protecting Medicare information, but we find that people's overall healthcare information, whether it's insurance or their filed and healthcare data that is out there, it kind of gets all wrapped up in it. So I just sort of leave it as general health information. Detection is knowing how and where to look for suspicious activities. And I think probably most people in the public don't know where to look for those kinds of things. They maybe don't look at their bills or their healthcare and health insurance statements all that closely or all that often. And then reporting. So if you have a problem, where do you report it? And that can be very confusing. If people have fraud, they're not quite sure what kind of fraud it is, they just know it's a problem, they'll just do Washington State fraud, and they'll go through the whole list of agencies to try and figure out where they're supposed to report it. So let's take just a minute. We are going to talk about cases, but I want to talk about the prevention and the outreach education piece first, because that's how we inform consumers of what to be aware of, right? So they can protect themselves, what they're looking for so they can detect a problem, and where to go to report it. So the best way to get that information out there is through outreach and education. We can do outreach and education either on the individual level, like when you're doing Shiva counseling. You have somebody that's new to Medicare, you're talking to them about, this is the process for enrolling in Part A and Part B, and then you're going to look at a Part D plan, or you could choose a Part C plan and all of that stuff, right? And guess what? There's about 30 seconds in there, anytime during that conversation, where you can talk to them about, by the way, you're on Medicare now, and your Medicare information represents a huge cash cow to criminals. It is a huge dollar sign to them, and they will be calling you, and they will be looking for ways to get your information to use it in criminal activities, to use it fraudulently. So here's what you can do to protect yourself. Don't answer calls from unknown numbers. Don't talk to anybody that says they're from Medicare. And check your statements every month. You can set up an online Medicare account so that you can check your Medicare statements every month. So that's something you can educate in the moment with every conversation you're having with a Medicare beneficiary or a member of the public. And then, of course, we think of outreach typically in groups, right? Small groups, large groups, virtual, in person, all of those modalities or media provide opportunities to share with people what we see as far as fraud, errors, and abuse, what they should be looking for. Group education sessions are intended to be interactive presentations. So I want you to keep that in mind. That'll come more into play when we talk in May at our third session in this series, because SMP has very specific guidelines about how to count these things towards our performance measures. But just know that the group presentations are intended to be, yes, a presentation of information, but also an interactive give and take where people can ask questions, they can ask for guidance, and they can report situations. Just a second here. Okay. So still sticking with group outreach, this can look like community events, outreach or education that maybe is not interactive can still count towards group outreach. But keep in mind that the interactive part is where you also can count counseling sessions. But a community event that would count towards group outreach might also be a health or senior fair, somebody's hosting a booth or an exhibit, providing information, pamphlets, the healthcare tracker, all of the things that might be good resources for people with regard to Medicare or healthcare fraud. And then an interactive group outreach session includes a presentation where educational content is provided to a public audience. And then they have opportunities at the end, either one-on-one with the presenter or other people, or in the group setting to ask questions. And that might be something like presenting about Medicare scam calls and how to protect yourself, or how to read an MSN, a Medicare summary notice. Some of the ideas, I thought I'd just plop some in here that people might think about for group outreach could include a presentation on can they do that. So when we're heading, and some of you probably already do this, so I'm probably preaching to the choir here, but when we get close to open enrollment, right, there's that barrage of Medicare Advantage plan advertisements. And every year we all kind of roll our eyes and get frustrated about the celebrities and just these huge ad campaigns that go across the country, but in some of your areas are completely irrelevant because they aren't plans that are available to the people in your, that live in your counties. But there are also unscrupulous people that sell these plans. In fact, I just had a report a couple weeks ago from a gentleman who was stopped on his way out of Costco by somebody who said they wanted to sell him life insurance and pressured him into setting up an appointment for this agent to come to his house. Agent comes to his house, which that part is, as long as the beneficiary agrees to it, that part's okay. Agent comes to his house, sells him a life insurance policy, and then proceeds to continue on for about 45 minutes about the Medicare products that his company also sells, and pressured him into buying a Medicare Advantage plan that he didn't intend to buy. And that part is against the marketing and agent guidelines. So having a presentation about what can they do, what can't they do, and we do have resources and materials to help you with a presentation along those lines. Doing a presentation that highlights different fraud alerts. The SMP Resource Center offers a whole list of fraud alerts that they update every couple of months. So it's sort of a fraud of the month type of idea where they have all the different frauds that are kind of currently hitting every part of the country. So you could even do a presentation focused strictly on what's fraud looking like these days, and then how do you protect yourself. And again, you can do something on how to read statements. A lot of folks really don't know how to read their statements, so doing a little workshop session on practicing to read their Medicare statements, their explanation of benefits, what are they looking for, how do they compare that to the actual visits they've had to the doctor and that sort of thing. So those are just some ideas for group outreach. Media outreach is not considered group outreach. It is kind of its own category. And when it's being entered into STARS, it is in the bucket of either other activities or media outreach itself. I'm trying to remember if it actually has a media outreach tab. I'd have to go back and look. But this is an activity that includes disseminating materials at libraries or senior centers, places around your community. But it also includes, of course, social media posts, those kinds of things. So if you post like consumer alerts or fraud alerts on your Facebook page or on Nextdoor and that kind of thing, that all would count towards media outreach. And that all helps to get the message out there. And then, of course, individual education. And this is really where we have the best opportunity to capture somebody's attention and help give them very specific guidance as to how to protect themselves and how to watch for fraud. So this includes our one-on-one conversations. It could be following a presentation. So you give a group outreach presentation, the presentation ends, And there might be some people that have personal questions or personal situations they want to talk to you about. Those all would count towards an individual education session, and that helps to inform them going forward. Addressing questions or concerns from beneficiaries that give you a call, you as the sponsor or you as the volunteer, or even us as staff. And sharing SMP information and volunteer opportunities also counts towards individual education or interactions. Fraud-related conversation with someone who's not a volunteer or part of our team about fraud or scam prevention, all is part of individual interactions and individual education. So those are all opportunities for us to get our message out there, to help warn people about the ways that criminals are trying to get our information. And I always tell people, remember that criminals, this is their full-time job, and they are highly motivated to be successful because there's a lot of money in it for them. We don't spend all of our day, every day, trying to figure out how to avoid being taken advantage of. So we don't invest as much time in protecting ourselves as they invest in trying to get our information. So I'm going to stop there for a second and just see if there are any questions, stories that people want to share, thoughts about kind of the outreach and education aspect of things. No, all good at this point.
Kim, this is
Yeah.
Jean Matheson.
Yeah.
I'm trying to get myself on screen here.
Sure.
I had sent one to you, and I believe that you had indicated it wasn't necessarily going to reach that threshold, but I really would like to just share this, if you don't mind, for 1 minute, about a letter that a client received, and it came from something called Unified, not United, but Unified Medical, and it was right after open enrollment ended, and we were heading into the Medicare Advantage open enrollment, and it was, we understand you have United Healthcare and your plan is going to be changing, and we've got a new plan for you. And it really led the client to believe it came from United Healthcare and that she needed to act. And so, maybe it didn't quite, measure up to somebody knocking at the door or whatever, but I felt it was really close. She ended up then in a plan that didn't work for her, but we were able to get it fixed. So anyway, I just want to share that because that letter was the first thing that I had seen of that caliber in all these years.
Yeah, and I appreciate that, Jean. The difficult thing, so there are marketing and agent guidelines that CMS has. Unfortunately, those marketing guidelines, there's still a lot of loopholes there. There's a lot of things that are not defined in those guidelines. I had a gentleman call or contact me about a week ago. He's new to Medicare, right? So his A and B are just going to be starting in about a month. He's enrolled. But you know how when you start Medicare, you get everything under the sun in the mail because all of a sudden now everybody knows that you're starting Medicare somehow. And he received a postcard that was in the same color scheme as Medicare. So it looked like a, red, white, and blue. It looked like it was a Medicare packet of some sort. And it said, we have your appointment scheduled for you on Thursday at 6 p.m. We look forward to talking to you then. And he's new to Medicare. So his thought process was, this must be Medicare reaching out to tell me I need to do something else. It was very confusing to him. So same kind of thing, Jean. And I call it masking. They sort of mask their marketing materials to look like, say, Medicare or United Healthcare. And when I did some research related to both your case and his case, I could not find anything specific that said they can't use, say similar. They can't put CMS on there and pretend to be CMS. They can't pretend to be United Healthcare. So they couldn't say United Healthcare on it and impersonate that agency. But if they put something close to it, I could not find anything that said that was against the rules, which I thought was interesting. Now, there could be some rule that's buried deep somewhere that I just couldn't find. And so if anybody does find something, please send it to me. But I couldn't find anything that said they couldn't do that.
Well, and
So,
Kim, I really appreciated your effort for it. And again, this letter said, I'm trying to reach you by phone, but I can't. So would you
mhm,
please call me? It was like they had intentionally designed the outreach so that they would not be held liable.
yeah, yeah. So frustrating. And again, because people are often new to this, or they just, I mean, Medicare is a confusing program as it is. And then you get all of this marketing stuff that makes it even more confusing, for sure. Yeah. And that might be, so just, to kind of go back to the outreach efforts, if you're doing a presentation that's either welcome to Medicare, or, can they really do that? A marketing, do's and don'ts type of presentation, you might bring that up. And you might just tell the audience something like, although there aren't any specific rules that say a company can't use the same colors as, a Medicare card or something like that, or a similar name, be on the lookout, because a lot of times these things are just advertisements that are trying to loop you in. It's not something you're actually signed up for. It's not an appointment you actually have. Um, that kind of thing. It might be another point that you want to add to your outreach efforts. Thanks, Jean.
And Kim, Annette Barker would
Yeah.
be.
Hi, Annette.
I've had several calls in the last month or so from elderly seniors, and by elderly I mean 80 plus,
Okay.
who've been fascinated or intrigued by the ads they're seeing on their cell phone for $3,500, $5,000 a year money if you fill out this application because you're qualified in that. And I've had that, are they really legitimate? How can we educate? I mean, maybe there's places where there is large amounts of money available to people, but how do we educate them that there really isn't that large of a sum of money that they for groceries or for bill paying or
Right.
whatever?
So there's a couple of things. The first thing I'll give you is a resource. So the Federal Trade Commission is on top of a lot of these types of scams. And in fact, they have a whole couple of web pages dedicated to unwanted calls, texts, and email. And they'll talk about that. And they do sort of a scam of the day as well. And many times in it, they talk about those exact kinds of schemes. So I would point people towards the ftc.gov website. I think it's .gov. Maybe they're .org. Anyway, sorry. To the FTC website and look that information up. The other thing is, what I tell people is, if you're receiving a text, an email, or a phone call that you did not invite, then be very suspicious. If they're reaching out to you first, it's a random text, most likely it's a scam. So most of the time in our country, if you have money hidden somewhere that you don't know about, you're going to have to go searching for it. Very rarely will anybody just send you a text that says, I've got extra money for you, even if it's in the form of grocery benefit or other things. So that's what I would advise most people, is just really be suspicious if you get a text saying you have something available to you that you had no idea about.
Thank you.
Okay. Good questions. Anybody else have a thought or question? Okay. All right. So let's take a little bit of time to look more specifically at what SMP casework entails. And of course, this is going to kind of, we're going to talk about this in terms of fraud, errors, and abuse. Most of the time, what does get reported to us are either errors, billing errors, or events of fraud. So billing errors. So this is where we see duplicate charges or incorrect coding, which is an accident. And billing errors are unintentional. It's not like a doctor's office or a supplier or service provider is looking to make mistakes, because if they submit claims to Medicare and their bill their coding is wrong and Medicare catches it, then they send it back to the provider who have to fix it. And they only have a certain amount of time to do these processes to get paid. So it's a complicated enough situation. Most billing offices try to be very diligent in how they bill for services. But that being said, we're all human, right? And mistakes happen. So what we often see, again, is duplicate charges, just an accident, not on purpose. Incorrect coding, they billed for the wrong thing, or charges for services that might be covered. And I'm talking about charges here on a bill. So they might bill a patient for something because they didn't realize that it was a covered service. Or it might be the reverse, where they billed for something and it wasn't covered. So there's both ends of that there as far as errors go. And there's other examples, but those are just a few. Abuse or misuse, and I talked about this in our last session, is a lot harder to see on the outside. It happens more often behind the scenes in the processes that doctors' offices are implementing, and it is most often caught by Medicare itself. So, but this can be excessive charges or unnecessary services. And it might just be that the doctor's office is not aware that that's what's happening in their billing system. Most of the time, abuse or misuse, even though the terms sound really intentional, most of the times it's not intentional. It's just errors that have happened in their process internally that have become part of the way they do business. Providers that are pressuring beneficiaries into treatments. Now that falls between abuse of the system and fraud. So if that's happening, we want people to report it, because then we do investigate whether that is an intentional action on the part of the doctor or provider that we need to investigate. And misuse of codes for claims like upcoding and bundling. Again, sometimes that happens unintentionally and becomes a regular part of how they do their billing process, but it can also become something that is an intentional way of getting a higher reimbursement. So those are the kinds of things we want to watch for so that we can investigate it and report it as necessary. And then of course, fraud. So fraud, what I see most of the time are claims or bills for service or supplies that were never received. So somebody sees it on their Medicare summary notice or their explanation of benefits, and they never received the back brace or the glucose monitor or whatever it is. Or they never needed it. Maybe they received it in the mail, but they never needed it, and their doctor never ordered it. But it was a way for the criminal group or individual to bill Medicare and get paid. Using somebody else's Medicare number. You know what? I've had 2 cases since I started over a year ago with this. One just recently where, in fact, the recent one, this gal's Medicare Advantage plan got terminated. So she went to the doctor. Doctor said, you better call your plan because your card's not valid anymore. So she calls the plan and they say, oh yeah, you called us a month ago to change the address and to have a new card sent to you. Well, the address is in Michigan. And it was sent to them. But because it's in Michigan and this is a Medicare Advantage plan, it's outside the service area. So her insurance got terminated without her even knowing. I mean, the good part is that the criminal can't use it either, but for her, she has some health-related issues. She needs to know her insurance is there to protect her, and now she's got to figure out how to start over. So it does happen. I don't see it as often as, say, the durable medical equipment fraud, but it does happen where somebody else's number gets hijacked and used for healthcare services or other things. Unsolicited offers for free services or equipment. This can be anything from a genetic test gets sent to your house. Medicare will pay for this. You can find out if you're going to possibly get dementia or cancer or diabetes or heart disease or everything under the sun. Just send this kit back and Medicare pays for it, costs you nothing. It can be something like and I just had an idea in my mind, it went out. So genetic test, one of the common ones that just seems to kind of come and go, haven't seen it recently, but saw it 6 months ago. Somebody shows up at your doorstep and says, I'm just here to offer you a free in-home safety and care assessment. And if you qualify, Medicare will pay for myself or one of my staff members to come in, say once a month, once a week, whatever, to make sure that your house is safe for you. There's no tripping hazard. Make sure you have all the things that you need to stay safe and healthy for the rest of your life, that kind of thing. And it's a scam. It isn't real. It makes me nervous that there's somebody going door to door doing this, but I do see that. And then false diagnoses or billing for a higher level of care, right? This is, you go to the emergency room with a sore throat and they do a chest CT for pneumonia. That could be, a version of upcoding or trying to bill for a higher level of care. And impersonating a Medicare representative. This usually comes in the form of scam calls. This is when somebody receives that call and the caller says, yeah, this is Kim. I'm just calling from Medicare. And I just wanted to let you know that there are new cards being sent out. And I'm afraid if you don't check in, if you don't verify your information with us today, you're not going to get your card and you won't have benefits anymore. And of course, the person answering the call gets scared because they don't want to lose their benefits. And they give out their Medicare information. And then the fraudster goes on their merry way to bill all kinds of things to their Medicare account. So those are some of the common concerns that I have reported to us. So given kind of those contexts of what cases might look like, let's talk for just a minute about what is a basic interaction versus a complex interaction. And this is how SMP as a program defines the categories of cases or reportings. So, if we've got fraud, errors, and abuse, where do those things fall on the continuum of case complexity? And the national program kind of breaks it into two buckets, basic or complex. And then for Washington State, we include a little bit more in that basic as to what our SMP trained volunteers can do. And I'll share that in a minute. But for the SMP national program, a basic interaction focuses on education and educating and informing beneficiaries. So heavily focused on the education piece. And with that, educating about how to prevent and detect issues with fraud, errors, or abuse. This is a situation, or these are situations that involve questions that can be easily resolved. So something where you might automatically have the answer, you just know, like, how often should I expect to get my Medicare summary notice in the mail? Well, most of us might know that's every 3 months. They might have gone to 4 months now. I saw some kind of release about that. But anyway, once a quarter is basically what Medicare does. So you could answer that off the top of your head. It might also include answering questions about the SMP program or about protecting their personal and health-related information, reading their statements, and where to report if fraud if it happens. You may have all of that information at your fingertips, or you may have to go find it. But either way, it's information that is general knowledge that is easy enough to share. And usually basic interactions do not warrant referral to other agencies, other than, like I just did with you, Annette, where I said the Federal Trade Commission is a really good resource to learn more about scams, that sort of thing. But it's not going to warrant referring the case for further investigation. Any questions about the SMP definition of a basic interaction? Okay. So how do we handle basic interactions? If you know the answer to the beneficiary or the group's question that they're asking, or you already know what information you want to share, like make sure you check your statements frequently and carefully, that sort of thing, then you're just going to go ahead and answer the question, right? You're just going to provide the information. If it's something that requires a little bit more research, maybe somebody's asking you for some resources on how to read an MSN, or they're curious if there's a tool they can use to track their appointments with their providers, lab referrals, that sort of thing. And you're thinking, oh, I can get them the My Healthcare Tracker booklet, and that would help them. That's the situation, right, where you know you're going to have an answer, but you don't have it right in the moment. So you're just going to say something like, I can answer your question, or I have that resource for you. Let me get back to you. I'll give you a call, an email, whatever it is, and you can provide that information. So either way, it's providing information in the moment, or it's providing the information once you're able to gather it and send it out. These basic interactions are all activities that every volunteer can do. It does not require any specific training. You don't have to be SMP certified to do any of these activities. These are things that you should be and could be doing as part of your regular interactions with consumers, with community members, and with beneficiaries. What are the actions that you might take? So if it's a question or a concern that's about SMP, or it can be answered with general education, go for it, answer it, right? If you know the answer, give it out. If you're not sure, or you need to figure out where you can access additional resources, then you can reach out to me. You can reach out to your volunteer coordinator. They might have to contact me if they're not sure. Or you can reach out to your regional training consultant, and they can share where to find the resources, the tools, or the answers that you're looking for. If you're sharing tips for keeping your people's Medicare and personal information safe, do that as often as you can. That is the number one key to all of the work that SMP does. It might include assisting beneficiaries to read and organize their statements, or it might mean suggesting where they can report fraud if it's suspected. That's still considered a basic interaction. You're not actually investigating the case. Somebody comes to you and says, I see durable medical equipment on my claims. You can refer them to our website, and I'm going to show you where that report form is located to report the fraud, and then internally we would take it from there. But you can still do that part of it. Complex interactions are on the other end of the spectrum, right? These are interactions that focus on much more extensive research and client interview skills, a list of interview questions, that sort of thing, that are necessary to establish the details of the case. So this is where we're peeling the onion, right? We're trying to figure out what happened when, to who, what's the cost, who's involved, all of the details. It requires that the beneficiary hopefully can submit documentation to verify their concern, or to show the entity that is involved in fraudulent billing. It involves a client interview where they might have to disclose they have to disclose their personal identifying information, like their Medicare number, their date of birth. So I have to gather all of those details as part of the report I compile to send on to the Office of Inspector General for further investigation. So there's a lot of those personal details and case-related details that have to be included in that report. It might require a referral to other appropriate and authoritative entities like the OIG's office, but sometimes I actually am making a referral to, say, the Medicaid fraud PIP line, or to somebody's United Healthcare or Medicare other Medicare Advantage coverage, because they also have fraud investigative units in each of their company framework. And it requires a detailed entry and report into the Senior Medicare Patrol Information and Resources System, which is the SIRS database, which only staff have access to that. That is not a system that volunteers have access to, which is another reason why complex cases come to my desk. So you're wondering, okay, then we're not doing the complex cases, Kim, why are you even telling us about it? Well, if you're aware of what constitutes a complex case, it helps in making that referral to my desk. So any question that requires that additional research or gathering of details I've talked about, beyond providing basic education, should be submitted using either the SMP online report form, and that's the link right there. I will see if I can copy it and put it in, excuse me just a minute, in the chat. Give me a second to do that. Or you can call this, they can call a Shiva helpline as well. Okay, so there's the report form. That is my preference when people are reporting, that they do it through that form. And the reason is it asks some really specific guiding questions so that when it gets to me, I have enough information to get started on the investigation and the research. Otherwise, they can call the number, the 1-800 number. What I often find is people will make a call like this. This is Kim. I've had some fraud. There's some kind of fraud happening. There's fraud on my account. I don't know what the fraud is, but there's fraud and I need something done about it. Call me back right away. So what I understand there is there's fraud and it's a call from Kim. But what I don't know is what kind of fraud. How did they find it? Do they have an email address that I could use to schedule an appointment to interview them and find out more? So when you're working with a client or a beneficiary, if you're talking to them about reporting, you might encourage them to do the online form. Now, I understand there are a lot of people that don't use the internet much or are not comfortable using electronic forms. Then certainly encourage them to call the 1-800 number and maybe just remind them to provide enough detail, hopefully an email address if they have one. Certainly encourage people to report their concern, even if they're not quite sure it's fraud. Like Jean reported that situation where it looks like really some sketchy marketing, and that was the right thing to do. Even though I couldn't find a regulation that said they were breaking some rules, it was still a valid concern and still important for them to report it to me so I could look into it further. So if somebody is kind of on the fence about reporting something, please encourage them to do so. And then when you have those kinds of interactions, enter your interaction into STARS, just like you do with a beneficiary counseling session. And we're going to cover more of this next month. So please do join me next month. I'll be much more detailed about the STARS entries. But right below where it says yes or no to is it a MIPA related case, there's another little phrase that says send to SMP, and you're going to select yes. And then put in the topics, you're going to put fraud and abuse under part A and B, part C, part D, whatever it is, and then email the STARS number to me. I know that's a lot to remember, and we'll cover it next month, but that way it gives me a heads up, and there's already something in the system for me to access and to build on. That was a lot, so let me stop for a second. What questions or what thoughts come to mind? Even if it's like, Kim, I don't think I can do all that. Please just tell me that and let's talk about it. All good? All right, you guys are awesome. All right, where do we go from here? How do I know if it's complex? Peggy, I'm gonna stop. I see you have a comment. Peggy says, some people have expressed reluctance to put details in any database since DOJ has gained access to all government databases. This is true. So somebody has to make a choice, right? If they are experiencing fraud, then unless a report is submitted to an authoritative agency for investigation, the fraud is going to continue. And unless we have the ability to reach back out to that concerned individual, to instruct them on getting a new Medicare ID number, if that's appropriate, or whatever steps they need to take, then again, they're going to continue to be, the source of scams and fraud attempts. So I don't have an easy answer, Peggy. I think there are always going to be people that are nervous about submitting a report. So it's kind of a balance, right? If they want to protect their healthcare information, there are a lot of steps that they can take, and we can help them do that. But there isn't anything that's perfect, whether Doge is in existence or not. Our personal information, my personal information, yours, gets out there into the wherever all the time without us knowing. So there isn't a great way to protect it, other than I would say the systems we use are all safe and secure and protected. That's why I like an email, because I can schedule time to call a concerned person or a client rather than try and correspond about Medicare numbers and that kind of thing electronically. I can call them and get that verbally from them. So let me know if that answers your question or makes more concern. I don't know. Okay, so how do we know if something is complex enough to spend on? So certain topics can be so complicated that it's best to refer them to somebody trained, like myself or Philip or other people in our staff directory that handle these kinds of cases. And a few examples of these are going to be things like somebody gives out their social security number and they shouldn't have. So if somebody reports that to you, again, you can reach out to me, or you can encourage them to file a report with that online report form, and I will give them some instructions on what to do to report that. The social security number being given out is even more complicated than a Medicare number, because that can lead to full-on identity theft, and they may have to talk to their bank and other financial institutions to figure out where to go from there. A beneficiary is requesting help, saying that Medicare won't pay because they have other insurance. Again, that's a complicated case, probably not fraud, but that's something that we as internal staff can certainly handle. It would take some investigating, utilizing some of the databases we have access to, but that's certainly something that I would encourage you to refer to us internally. A beneficiary complains about advertisements for Medicare-related plans or Medicare-covered products because they think they're misleading. Again, this goes back to Jean's great example. If there's a question where it really seems like it is at the very least unethical, send it to us, use that online form if possible, and we can check it out. A caregiver calls about poor quality of care and medical services their mother's receiving. See, again, this is a case where I would need to know a little bit more about what poor quality of care means. Is mom in an adult family home and there's possibly a case of abuse or neglect that goes a certain direction? Or is it a case where the provider or a skilled nursing facility is just not providing adequate medical care? That goes a different direction. So those are situations where if it's just sort of that gray area, but certainly it sounds like there's something wrong, encourage them to send it through our online reporting form, and we'll kind of unwind it from there. All right. Again, where can people report fraud? So certainly to us, and there's the website that I provided, or the link that I provided earlier with the fraud report form, calling our toll-free number. The SMP National Resource Center or national website also has a hotline and a report form, so you can send them there. People can find SMP or report fraud issues there. People can report fraud directly to the Office of the Inspector General. And what I will say is the OIG's office has a web page for reporting fraud. They also have that number there. They have very specific guidelines as to the types of cases and the documentation that they require to move forward with an investigation. So that might be something somebody would have to look into a little bit, but they can certainly go that direction. And people can report scam calls to the Federal Trade Commission. FTC, I always say, is kind of, they're the go-to agency for scam calls. They have the ability to gather information related to who the scam caller says they are, the phone number that shows up, even if it's a spoofed number. They gather all of that, and then they have the ability to investigate it further. All right, so let's talk for a few minutes, and then we'll get ready to just answer questions and wrap up, share stories, that kind of thing. What are some Medicare fraud schemes? I'd like to give examples, right? Because for those of us that maybe haven't experienced fraud, it just helps to be able to kind of get a sense of what this looks like. So a closer look at these. So Medicare fraud typically involves intentional deceit, right? So they are looking to manipulate somebody or manipulate the system to get paid for personal gain. Anyone can be involved in fraud. It can include doctors, providers. It can even include beneficiaries, people that are utilizing the system in a way to get something they're not owed. It can involve billing services, or billing for services not provided, misrepresenting diagnoses, or even offering kickbacks. Medical identity theft. This again goes back to the number one thing we educate the public about: treating their Medicare cards like it's a credit card. I know we all hear the guard your card saying over and over to where it almost means nothing after a while, but it truly is a big deal. I would say, don't just guard your card, guard your number. Don't give it out to people that call. And we just said that. So now I'm going to go. So stolen Medicare numbers do lead to false. Oh, there we go. False claims. False claims may lead to future denials of claims for services or supplies that are needed. Once an ID is stolen, it is repeatedly used fraudulently and sold to other fraudsters. So calling Medicare once you have a compromised Medicare ID is important, but beyond just reporting it and asking a fraud alert be on your account, I always tell people, request a new Medicare ID number. I know Medicare doesn't like to give them out, but as long as a criminal entity has your number, they're just going to continue using it or selling it to somebody else who's going to use it. So the only way to stop it is to change the number. The amount of money lost every year to Medicare fraud is over $60 billion. And it increases the cost to all of us. And these fraudulent practices lead to inappropriate and unnecessary medical interventions. So we want to really emphasize those things to people so that they don't just think, well, this is Medicare's problem, not my problem. So, I'm not going to worry about it. They should worry about it. These are I shouldn't say all, these are some of the types of fraud that we see. It can be around ambulance services, lab services, durable medical equipment. All of these things are areas where fraud can happen. So anything that is a benefit is an opportunity for fraudulent claims. An example of provider fraud might mean altering claim forms to get higher payment amounts, and this is called upcoding. And we talked about that just a little bit earlier. Excuse me, just a minute. Let me fix something on my screen here. Sorry, I lost the page that I had going. All right. Billing twice for the same service or item, and that does happen. Billing separately or unbundling, so that might be something like we all get those comprehensive blood panels, like when we're at our annual checkup or things like that. If they bill separately for each of the items on that test, that would be an unbundling. Billing for services that are not rendered or supplies not provided. So one example includes this doctor in Palm Beach, Florida. He partnered with another doctor in a kickback scheme. The Palm Beach doctor falsely diagnosed benign freckles and warts, and irritated skin as cancer. So he just kind of routinely diagnosed everything as cancer. And for 6 years, this doctor sent over 35,000 Medicare biopsies to a pathologist. The pathologist then would receive kickbacks or payments from the doctor for false readings. So he would go along with the diagnosis. The doctor allegedly charged $18 million in false claims to Medicare, and the federal government is still working to recover that money, but acknowledges that it probably will only get about $5 million back of that. The doctor has a sprawling 12,000 square foot oceanfront mansion in Florida, valued at $28 million, but because of the laws in Florida that protect homesteads, they can't use that, they can't claim that as to recoup. This example includes a pharmacy fraud scheme in which a family operation, so an adult son, his mom, his aunts are all licensed pharmacy technicians. They run 8 small pharmacies in Miami that serve as fronts for fraudulent activities. So basically the son pays patients and recruiters to gain access to Medicare ID numbers. And then he bills Medicare for medications that are never dispensed. The son pled guilty to conspiracy to commit healthcare fraud. The Justice Department snared he and his family as part of a nationwide crackdown on Medicare and Medicaid fraud. And the Justice Department charged 243 people with $712 million in false billings. The family scammed Medicare for $21 million. And he alone, just he, was responsible for $5.5 million worth of fraud. So not chump change, right? Attempting to launder the proceeds and hide the money from the authorities, this only 24 years old, the 24-year-old son purchased a Rolls Royce, a Bentley, a Range Rover, a Mercedes-Benz, I think he likes cars, and 2 homes, $100,000 in jewelry, and he charged $2 million on credit cards. A little bit of money. So let's take a look at some examples of scams or imposter fraud. Medicare scam calls. This is what I get day in, day out. Every day of the week, people call and say, I'm getting these calls, right? We talked about this before. You'll hear me say it over and over and over. Criminals are impersonating Medicare or other agencies. The ones we hear about are Medicare impersonations. They call and say, I'm a Medicare representative, just need to verify your information. I just had a call or a report the other day. This woman, she doesn't even have a doctor because she doesn't ever see doctors. She's in great health. She's in her 80s, but she's got her Medicare. She started getting these calls, and the call said, yeah, did you know your Medicare card has expired? She said, no, I didn't know. Yeah, look at the date on your Medicare card. Okay, somebody tell me, what is the date on the Medicare card for? What does that represent? Just go ahead and unmute and tell me.
It's the day your Medicare began.
Yes. But this woman never uses her insurance. She doesn't go to the doctor. So it was just a card, didn't mean anything to her. So she looked at the date and she's like, oh my gosh, my card expired on whatever date she enrolled. So she bought into what this person told her. And they kept calling and to get more and more information from her. So they will try anything. It just, goes to show how persistent and annoying they are. The thing to tell people and to keep in mind is that Medicare won't call you uninvited unless you set up a scheduled appointment with a Medicare representative. Medicare's not going to call you out of the blue. And they're certainly not going to ask for your Medicare number because they already have it. They don't need you to verify it. Imposters can be, and these fraudsters can be aggressive. They can threaten that your benefits are going away. They can start yelling and swearing at the individual and be very scary. The number one thing is if people keep answering the phone, the fraudsters will keep calling. The absolute only way to get it to stop is to not answer the call. So if there's an unknown phone number, don't answer the call. As soon as you answer it, your phone number or their phone number is flagged as an active number that they can keep calling to get the information that they want. So in this example, my screen keeps changing. Sorry to be so flaky here. This woman, somebody ended up using her Medicare number to submit fraudulent claims for a wheelchair. Medicare paid the claims, even though she never received the wheelchair, she never saw the wheelchair, never ordered the wheelchair, and didn't need it at the time. But down the road, she did have some mobility issues. And when she actually needed the wheelchair, Medicare denied her legitimate claim because it showed she had already submitted a claim for it. She had already had a wheelchair. So in their records, she already had one. Durable medical equipment fraud. This is, again, another one that gets reported day in and day out. So in this case, a woman who is helping to manage an adult family home attends a health fair with her residents. So she takes them out, they go to a health fair. She notices that some of her residents and other people at a table are giving a representative their Medicare ID numbers and other personal information for a quote unquote free wellness item. So about a week later, a truck full of motorized wheelchairs shows up at the adult family home to deliver these wheelchairs. That the residents didn't know that's what the item was. They didn't know they were signing up for that and didn't need them. So she contacts the authorities and the FBI. The FBI sets up a sting, and undercover agents filmed the fraudsters at another health fair doing the same thing and then subsequently delivering wheelchairs. So the FBI ends up arresting these individuals and they were prosecuted for fraud. The DME supplier, so the entity that was doing this, gained access to the skilled nursing facilities and senior care homes, and 99% of his submitted claims were for power wheelchairs, which are a much higher reimbursement rate. Many clients never received the equipment or didn't need it outside of those ones where they delivered the truckloads of it. And most of the Medicare numbers were provided by patient recruiters who then received kickbacks. So it looks like they had two kind of consecutive schemes going at the same time. I'm just going to check, make sure you can see. Okay. So why durable medical equipment? One reason is that until recently, there wasn't professional licensing required to be able to be a supplier, provide that. Suppliers could set up shop with very little investment. And there's a huge potential for quick profit, which we're still seeing. They can send those claims and get very quick and easy reimbursement. What to look for: unauthorized, unsolicited supplies sent to an individual, claims or supplies not needed, requested, or received. And then lab services. What's the benefit of doing lab services in that way? Doctors don't see what's billed to Medicare when they submit for lab services. Labs aren't required to submit a diagnosis information to support the need for the services. So people can look for unnecessary services billed, again, checking statements, and providers can strongly encourage their patients to go, or if a provider is strongly encouraging a patient to go to a specific lab, sometimes that can be an issue or a sign of there being some kickback. Unbundling, again, the one blood panel being broken down into multiple reimbursements, or tests that are not ordered but are performed and billed. Part D prescription drug programs are also another area of fraud, although I don't get many of these reported. Common types of prescription fraud include billing hundreds for prescriptions for a single client, dispensing less than the prescribed number of pills. And I do hear these stories. I haven't had it reported to me, but I do hear these reports. Claims for brand name drugs being submitted, but only dispensing generics for a lesser amount. And large numbers of claims for refills that are not requested. So we're kind of wrapping up here. Our key takeaways when it comes to fraud, errors, and abuse are protect personal information. And that shouldn't just be about Medicare, right? That should be about all of our information. Be mindful of scams. Again, back to what Annette brought up, or Peggy, or no, I guess it was Annette. Somebody's getting emails or phone calls or texts or any of that unrequested, uninvited. Most likely it's a scam, and it's looking to get you enrolled in something or give out something that you don't want, don't need, and shouldn't participate in. Review statements carefully and frequently. I encourage people to create an online Medicare account. And here's my shameless plug for AARP. They do have a really, really good article about how to do an online account. It walks them through the procedures and the process for setting up an account. For some people, that's really helpful. Report suspicious activity, even if you're not quite sure. Better to have it checked out than to let it carry on. And stay informed. Check in with me if there's any additional resources. I'm always happy to share a ton of information and materials, but you can also visit the SMP Resource Center for their latest fraud alerts or any other materials that you might use out in your communities. For you as volunteer staff or coordinators, what are some key thoughts or activities? Continue learning about SMP resources. I encourage you and all of your colleagues to continue joining these types of sessions or any kind of learning events that are available. And then educate and inform consumers. We're really doing a public service by helping people be aware of and know what to watch for, but being aware of fraud that's out there. Share resources, print materials, information, outreach within your own community, and coordinate that outreach and counseling efforts and activities with me as the SMP coordinator, but also with other Sheba staff, with your other volunteer colleagues. The more of us that are doing this, the more impact that we'll have. And then report. If there is any inkling that it's a billing or a fraud issue, I'd rather have it reported and be able to say, no, there's nothing to investigate here, or yes, we need to investigate it, than to just let it go. All right. And I'm going to end my sharing. And check in with all of you. That was a lot of information as always. So I open it up now to you. What questions do you have? Stories that came to mind, concerns, things you're not sure of, requests? Open mic time. Jean?
Yeah, I do have a question, and it's, and I don't know if Kim, if this is the place to go, but I remember some years ago, I had a training about Medicare fraud, and the big thing at that time mentioned, I mean, by a far thing, was DME. So all sorts, and there was a phrase that was used. It was something like Medicare's policy had been to pay and chase. So they were paying for equipment to fraudsters who didn't even have, a walker. They were just paying out. And so that there was going to be a real effort made to make sure that when claims came in, that these providers had been vetted to some extent, and they were found to, in fact, be licensed and credible DME suppliers. And what worries me now is that I'm not sure, is that still the case? Is DME still relatively more safe, or are there things that we should say to clients about where you should go to get your equipment supplied?
That's a really good question. So to the first part of what you said, the pay and chase policy is still there. We can still rely on that with Medicare. Part of what I think has happened is, yes, suppliers are supposed to be licensed with Medicare. They're supposed to register their provider ID number, and so they have to get a known provider number. But those are easy to get. Anybody can get them. And then once you have them, there's some paperwork you have to submit to Medicare to be registered with Medicare. I think if I were advising a beneficiary because they are expecting they might need, maybe they're going to have knee surgery and they're going to need a walker for a little while or something like that, make sure the only reason you're getting a piece of equipment is because you and your known doctor have had a conversation about it. what I see when I see these Medicare claims, and there's durable medical equipment on it, they are also stealing the identity and the provider ID numbers of doctors without the doctors knowing. So they'll list a provider that has referred this item or items, but the beneficiary doesn't know that doctor. It's not their doctor. So make sure it is initiated through their doctor. The supply company or equipment provider, they're asking questions like, what is your process for getting me this piece of equipment? If they can say, here's how we do this, instead of, oh, it'll just show up at your door, that'll give a little better idea of whether they know what they're doing. Most of the time, they're going to contact the supply company. In the fraud cases, the supply company, the fake supply company, is either contacting the beneficiary or somehow the beneficiary's information has gotten out there, been stolen, and the fake supply company is just billing Medicare, and the beneficiary never even knows anything about it. It just shows up. So I think to me, that's the biggest distinguishing part is it initiated by the beneficiary and their doctor or by some unknown entity?
Thank you.
Yeah. What else?
One of the things that I've been getting reports on, people are getting phone calls that say it's from their hospital or their doctor's office.
Yeah.
And it's actually not. So somehow they're gaining information about who they actually see, which makes it very difficult to know if it's a fraud.
Yeah, it's such a good point, Peggy. Again, right, these criminals, it's their full-time job and they're so highly motivated. They have software and technology capability to spoof their number, but to the point that they have enough information on an individual to know which doctor they go to, and can spoof the number to actually be their doctor's number. And then they say this is your doctor's office, right? And think about this, if a beneficiary is expecting a call from their doctor's office already, or they're in the midst of, say, a series of treatments, or they have a surgery coming up, and their doctor's office calls, the first thing I would think is, oh, there's a problem with my health. So I need to talk to them. I wonder why they're calling me, right? So it's a really hard one. I guess I would say if a person is not expecting a call from their doctor's office, as number one, don't answer the call right away, let it go to voicemail, and then call the number you know is associated with the doctor's office, not the number that shows up on caller ID, because they can redirect it. So if my Dr. Smith is calling me and I'm like, oh, I wonder why they're calling, let it go to voicemail, and then I can look up my Dr. Smith's office and call the number that's listed. That would probably be my first recommendation. If they call, or if they answer the call, then probably asking enough questions like, is this related to my last visit? When was my last visit? And see if the caller can identify that. Maybe asking some screening questions.
We've been telling people if they get a phone call from their doctor or their office that there's an ongoing scam, and just say, let me call you back. And then you say, look up the actual number and call it.
Yeah, that's good. That's perfect. Yeah. Yeah. What else? What, I know people are probably getting ready to jump off and we're getting towards the end of our time, but I'm curious, as you all are doing work out in your communities, what's your biggest challenge in trying to educate the public about these kinds of topics? I mean, it's straightforward to go and talk about Medicare, right? Because people are challenged by the complexity of Medicare. But I know talking about fraud is kind of a whole different thing. So do you find it challenging to get people to attend to that kind of topic?
I do, because people don't think that they're going to be subject to it until they actually are.
Yeah.
I think another part of the fraud thing is the changing environment of it. There's so many different fraud pieces that happen. Doesn't happen to everybody, but it happens enough. People might get bored with it. I think one of the things that people attend to a lot are the unsolicited mailings that they get and the frequent phone calls. But I did a bunch of homework through the FTC portal you were talking about concerning unsolicited emails and phone calls, either through a cell phone or through a landline.
Right.
And legitimate advertisers cannot contact you on either of those two phone calls or text or cell phones.
Right.
Unless you give them express permission to do so. And a lot of that express permission comes through innocuous time on websites
Yes.
like Medicare.com or a letter or something you get that you respond to thinking it was an important document from the federal government. And those things open up all kinds of, well, what happens is your information gets sold on the market, and then you're going to get a lot of calls and stuff like that. But that stuff gets a lot of attention from people. Those are the kind of things that cue people's energies more than direct fraud. But because of the fraud stuff that I've talked about and that you've talked about, or that, you know, other people have talked about, people are checking their explanation of benefits and finding things that never happened, and then we go down that path. But there's a lot of pieces that generate a lot of wasted energy on people's behalf.
Yeah, agreed. One key thing there that you said, Dave, that I like is, so the Federal Trade Commission said that there are regulations around when legitimate businesses can contact you. So if you're being contacted by, a fake Medicare or another agency or somebody that is pretending to be a legitimate business, you should question it.
No, it's fraud. You didn't ask for it.
Right. And people will say to me, well, I register for the do not call list. And I always say that's great for legitimate businesses. They're supposed to adhere to that, but a criminal doesn't care.
Or you step around that thing that you did by answering something or clicking on something on the internet, then by default you're giving somebody permission to the queuing thing, the permission process. FTC talks quite a bit about how that happens, and so that was a good place for me to go look at.
Good. And that's a good point. Maybe that'll be a good news flash article to send out about that information from the FTC, and we can send that out to all of our networks. So that's great. Thanks, Dave. Anybody else? All right. Well, I appreciate it. I'm going to stop the recording.